pay the electric bill.
Good morning, everyone.
Sorry for that.
I'd like to call to order the Audit Committee of the City of New York for the May 29th, 2019 meeting. And I'd like the secretary to call the roll.
Our private members, Mr. Michael Spitzer, Chair.
Present.
Mr. Bernard Rosen.
Bernie,
Here.
Mr. Mark Kaplan.
present.
Mr. Bud Larson.
Present.
Representing Comptroller Scott Stringer, Ms. Jacqueline Thompson. Present. We have a quorum.
Thank you. Before we begin, I just want to read in, not to read into the record, just make a couple of comments for the record. John Grathwold, the mayor's representative, retired. So I just want to get into the record that the audit committee would like to thank him for all of his years of service on behalf of the mayor and on behalf of the audit committee.
And the people of the city of New York.
And the people of the city of New York. Thank you. I'd like to have a motion to accept the minutes of the March 27th meeting.
So moved.
Thank you. And the April 3rd, 2019 meeting.
So moved.
Thank you. Okay, next up on the agenda is the New York City Health and Hospital Corp. Will you please introduce yourself and all the members that are here with you?
Yeah, I'm John
For
Olberg.
the record, Mr. Chairman, I'm going to recuse myself because I was a member of the board during the audit period that year.
Thank you.
Sorry.
Yeah, good morning. Happy to be here. I thought maybe what we could do is just go down the line and introduce, my team that did all the hard work on the audit, and then I can start from there.
Good morning. I'm Joseph DeBroy. I'm a Director of Finance.
Morning, Jay Wyman, Corporate Controller.
Nicole Fleming, Controller. Tammy Radinsky, Grant Thornton, Audit Partner.
Dana Wilson, Grant Thornton Insurance Audit Partner.
Lou Fierstein, Managing Director, Grant Thornton.
And Steve Diaguardi, Senior Manager.
Thank you.
I'm John Olberg. I'm the CFO for H&H. I was taking the train down this morning from Albany, and I was thinking to myself that it's almost been a year since I've been at H&H, and it's really been quite a wonderful experience, and very fortunate to have such a fine team. We will go through the details. Have Jay go through the details with us. I think, for the most part, the FY18 audit, we were very pleased with it. It was the first engagement with Grant Thornton, which we kind of appreciated their fresh perspective. I would say, from kind of two perspectives. I think there were no major policy issues or protocol problems. We've told Grant Thornton as a big public hospital system that are the stewards of billions of public dollars. We take the audit process very, very seriously. And when there are problems in our minds, those are really opportunities to fix things. So we welcome the bad news along with the good news. But I think overall, we fared positively. I think from a financial perspective, we did equally as well. Our FY17 results were $232 million to the negative, and we reported an $1840 million to the positive. So that was a swing of $270 million, which I thought was it was material for a public hospital system that struggles every day, to make margin. I'll also say, I'm still new to the team. Dr. Katz, brought in a very, skilled and talented group. And when I was considering the job, from the very beginning, I really bought into the plan. Right, it's a very well balanced, robust, far-reaching plan that we work hard to execute on every day, and we're starting to see, some of the results, materialize at the bottom line. Dr. Katz very clear. If he has three things that he's working on, number one is the stabilization of health and hospitals financing is up right near the top. So again, we thought the results were good. We reported, I'll just kind of take us forward, kind of where we are today, and then I'll have Jay, go through the results of last year. But we reported in the second quarter that we were about 1% off budget, which for us was not, 1%'s a lot of money. I always say we always make our living in the last 1%. But, I didn't really have us too alarmed because we thought that there's, things that were delayed, right? We could manage, and I think we're got a quick look at the third quarter, and it looks like we're about, break even. So the longer we have runway at break even, I'm comfortable because it gives more time for our plan to, cement and take shape. And again, as I said, we feel pretty good about that. We did report to City Council part of the second quarter that we missed one of our group of our revenue targets, and as Dr. Katz says, if we hit all of our targets, he didn't set the bar high enough, so we missed that by $45 million. On the expenditure side, we overspent by about $35 million. Again, that was intentional. We made a decision that we needed to have more nurses on staff. Dr. Katz is clear that if we can't provide good, safe, effective care, we shouldn't be in the business. So we made that decision to hire 340 nurses. And that ramped up pretty quickly. We also brought in about 170 folks to run the rev cycle system. That's what we refer to as our billing system. If there's kind of the fundamental things that we need to work on every day, it's re-standing up our rev cycle system. And we've brought on a chief revenue officer, and we're again starting to see dividends pay off. But those were really the reasons why we overspent. And then to offset that, there's about $50 million in what we call Medicaid admin. This is federal dollars that come into us as a result of the administrative functions of the Medicaid program. So net, I think we're down $30 million, and if we hit our cash target will be, I think, about $30 million greater than it was last year. So that's, kind of just an overall recap. I would just close by saying, it's not the things that are internal to H&H that, if I do get woken up in the middle of the night, it's not those things. It's the external risks. And I would say at the fore of that is the DISH cuts. You may hear about that. But we're, the lobbying campaign with Congress to avoid those DISH cuts. That'd be, about $400 million hit to H&H would be substantial. And a couple other things that are really primarily aimed at us from, the federal government. So we keep our eye on those things, very closely. So with that, I'll turn it over to Jay and give you an overview of how we did in 2018.
All right, thank you, John. And as I'm going through this, I'll try to relate some of John's comments in with the results. Firstly, I'm just going to give a high-level summary, but I did want to mention that we have an unmodified opinion. Obviously, that's what we want. That's what we got, for the first audit of Grant Thornton. As John mentioned, our net increase in net position is $39 million. Compared to the debt, the negative $233 million that we had last year in 17. I think what's important is, what are the components of, how we got from 17 to 18. So revenue increased by $467 million. Mostly due to DISH Max. Those are additional funds we get, supplemental Medicaid funds, and also increased collectability of about $115 million. Those are the efforts that John was talking about related to, improved revenue collections, improving case mix, which is a direct result of the coding efforts that our team has in order to bring in that revenue. And we had $67 million of additional managed care risk pool dollars from MetroPlus. Grant revenue decreased by $212 million because in 2017 we had 2 years of value-based purchasing quality improvement program dollars, and in 18 we didn't accrue anything because there was no signed contract. Those dollars will ultimately be recorded in 2019, but it did yield a decrease in the grant revenue. Expenses increased by $252 million. Personal services increased by $317. 356 of that was a direct result of collective bargaining agreements and increased costs for that. But we did have the $69 million of reductions to our FTEs, and that's basically what John is talking about, the decisions that we had in 2019 to help to improve the position on FTEs for revenue cycle and for nurses. So that did result in a decrease of about 2.5%. Other than personal services, also decreased by $53 million, and fringe benefits by $34 million. Just a couple of ratios, which is what we key in on to see how we're doing. Our current ratio was above 1. Again, a big improvement for 2017. We were slightly below 1. Days cash on hand was 36, an improvement again from 2017. And net days receivable, those are the days revenue that we have sitting, waiting to be collected, to 65. And it should be noted that the statewide average is just around 65. So we are doing a pretty good job at the revenue collections, and certainly all the revenue initiatives to help to improve that. We are on target. And again, our year-end cash balances was $747 million at year-end. So that's a high-level summary. I know that you've had the financial statements and the management letter, and at this time, if you'd like to ask any questions, we're available.
I'd like to start off with one couple. When I read the Grant Thornton,
Yes.
I read,
Speak into the mic.
oh, whoops, I'm sorry. I couldn't understand. Okay. Intimidating, huh?
Shoulder surgery.
I couldn't understand the reference on the first page, that said that the financial statements, it's in the third paragraph, for Metro Health Plan,
He's in the opinion.
the opinion, were not audited, and then you get to the next page, and you say, in our opinion, the financial statements and its discretely presented component units, you give an opinion. How did that one get excluded?
Which one?
Down here in Metro Plus, it says they are statutory reporting.
Yeah. So the financial statements are included and they are audited. They're not audited in accordance with. They're not audited in accordance with government auditing standards. They're audited in accordance with AICPA auditing standards, which govern the standards for insurance companies. So that's why they're a separate unit, included in the financial statements and audited, but not under government auditing standards.
Oh, well, for the standpoint of somebody who reads as a layman, it's not clear as to exactly what's going on. You might think about drawing that distinction at some point, so it doesn't give rise to the question I'm asking.
We can take a look at that. We've used the standard wording that the AICPA approves, but we
I
can
know,
maybe
but-
clarify that for you a little bit. We understand.
I had a question about the opinion also. In reading everything, I was always used to a different firm auditing Health and Hospital Corp. And, first question I had is this Grant's first year? And then in reading the opinion, there's no mention that you're relying on the prior auditors, and you're issuing comparative statements.
Yeah, well, there's an other matter paragraph on the second page of the opinion that references the other auditors.
Okay, I missed that then.
Yeah, no, there's a lot of different paragraphs, but that's the one that's referencing the other auditors, which is the prior firm KPMG, which issued their
Yeah, I
report.
know. I was trying not to mention the name. That's fine.
Okay, if I may, if you turn to page 3, you have current liabilities, and under that, you have long-term debt. Now, how can that be?
I'll answer. It is the current portion of the long-term debt, just by description, that's how it's denoted on the financials.
Well, when you go to a liability, where is the long-term debt on that page?
He would do better looking at the.
In that first line, the current liabilities. So you have current liabilities, it's a collapse of the detailed financial statement on page 16,
No, I understand it,
think,
but so what you're telling me is,
You see, Mark,
no, but I'm looking at,
truncated here.
I'm looking at page 3, and I see current liabilities, and underneath that, I see something called long-term debt. I don't have to get any further to say that's inconsistent.
Yeah, I think the confusion is that this was indented, looks like it's part of the current liability.
I understand that, but
Yeah,
I know it's there. But I tell you, if you start reading this thing this way, as a layman, and you see current liabilities, and under that, a subset of current liabilities, which is long-term debt, it doesn't make any sense.
I think this is in presentation.
Yeah, it's actually just a formatting
Right.
issue. If you look at all of the items that are indented under current liabilities, they're actually meant to be even with current liabilities.
You left the
So they're
lines,
each a
really.
separate line, not a subdivision
That's
of.
what I thought. So
Yeah,
you-
yeah, we will fix that.
Okay.
Yeah, we appreciate the thorough reading, right?
I'm
We do.
sorry.
Yeah.
If you turn to page 5, the second paragraph says the financial statements, the component unit, et cetera, are presented. However, the MD&A focuses. Why the however? Why not on the whole thing?
The MD&A follows the structure of the financials as it's presented. The discretely presented unit, which is Metro Plus, is not described in the MD&A according to GASB. We're just following the GASB rules. There are disclosures in the back that refer to Metro Plus, but in the base of the MD&A, it's not mentioned within there.
Trouble is, I didn't go back and to check against it. All right, I will give up on that one.
So,
And then-
Mark, actually, if you recall in the city, the component units for the city, they have their own separately issued financial
I know.
statements. So the MD&A for the city proper addresses the city's activities. It's the same thing for H&H also. So Metro Plus has its own separately issued financial statements that are audited. And even though they are a component unit of H&H, the MD&A of H&H proper addresses just H&H.
Okay, that's what I assumed. If you then turn to page 7, this is just words, but you say deferred outflows are largely determined. That, forget it, it's not worth it. Give me, I'll just go through this thing. Anybody else want to sound off?
Going back to the overall financial position and your comment about your big concerns, is it safe to say that you're suggesting that your internal operations and your internal revenue collections, you're now in a fairly comfortable position, and you feel that you would be successful on an ongoing basis if the feds don't come and do something else to you?
Yes.
Okay, that's why I read, to make
Yeah.
sure I was reading it correctly.
Yes.
You know, like in my read, it was like a positive thing based on the last several years as HHC came before us. You know, like hemorrhaging cash.
Yeah.
We've made the movements we've talked about in the past.
Yes. No, I appreciate that. I would say that there's probably, somewhere in the neighborhood of 30 to 40 different initiatives right across H&H, right, to, focus primarily on, financial stability, but also improving the, the quality of care. And we meet every month. Everybody gets assigned one of these projects. They report on the project. There's a lot of excitement around, people reporting on, how their initiative is faring, and it gives them a safe place to, come and talk to, senior central office leadership. Do they need more resources? But I would say, and again, healthcare in this town is very competitive, right? It's always changing, and I think while we're working on the fundamentals of getting bills out the door, we're also keeping a close eye on what does the future healthcare system look like. So all those things, but I would, short answer to your question, I think we feel pretty good looking forward.
Yeah, and in short, you've taken on a number of significant initiatives to improve it, and you have an ongoing process to identify things in the future. So this is a continuation,
Yes.
it's not over.
That's right. Yep.
Especially with what may come out of the federal government, right?
Yeah, the federal government thing is just, it's largely political. There's not so much that I can, specifically, do about it other than, prepare ourselves and develop strategies in the event that it were to happen. But we rely on the delegation and, the hospital associations, and they assure us that, with the change, with the House leadership change, that dish cuts will more than likely be delayed, if not restored, so.
Moving from that significant issue, let me ask you a question about page 24. You have land, the depreciation, and something I'm not accustomed to seeing, land improvements. I mean, usually you have buildings and improvements, and you have land. What land improvements would be depreciated over a shorter period of time? Parking.
I couldn't really tell you offhand what's included in that.
It's just,
however,
I read a lot of these things, and I haven't seen that
In
distinction.
recent memory, at least in the last 5 years, we haven't had land improvements. So there may have been something on our books at some point, and this is just making reference to that, but we haven't had any land improvements. We have building improvements. We do that every year, but I couldn't really tell you what's
I
in the land
believe some of
improvements.
this is probably parking lots and things like that.
Well, the parking lots, we would not depreciate.
No.
So that would be land, but we could look into it and see if we have anything and get back to you.
But usually, land is something that doesn't get depreciated. And I have this issue elsewhere in my life. And then you say capital assets under capital lease obligation depreciate either lease term or isn't it usually the shorter of?
I'm sorry, I missed the question.
The language says capital assets under capital lease obligations depreciated either on the lease term or the estimated useful life. I'm accustomed to seeing the shorter of, but that's what you want. And then the custodial funds, do you invest those? Do you have them where they earn interest?
In the custodial funds, some of it does earn interest, but
It'd be
yeah.
meaningless in terms of everything here.
yeah, most of our custodial funds are not earning interest, but there may be some if it's non-patient related. But the patient related, I don't think, and again, I have to get back because I don't know. But most of
I would
that
have
is
thought you put it in a
separate
bank
accounts.
account, you trade a deal with the bank and you get some interest on it.
Yeah, the bank that we use, I don't believe, because there's very few banks that participate in the nursing home, custodial accounts that we have, which is, in essence sets up a separate account for each one of our residents. I don't believe that it earns interest, but again, we have to get back.
Well, all right. The reason I ask is I'm representing somebody who had an aggregate of accounts like that, and then somebody came in and said, well, you didn't invest the money, and it's a class action, even though it's peanuts.
Yep.
So
Yeah, most of the custodial funds are the residents of our nursing homes, and
No, I understand.
So they are deposited and used frequently.
okay. Now, if you go to page 34, you use level 2 to evaluate U.S. government securities. Other accounting, or other people treat that as level 1 because there's such a big market in those government securities. I'm just wondering why it was elected as level 2 here.
So
Doesn't make
those-
much difference, but I just
Yeah.
point out that
We have some securities that are due in over 60 days, and those would be level 2. The more current ones would be level 1.
All right, well, that's what you... And then when you get over to page 38 and 39, you refer to premiums, and you say the issuance generated a premium. What the economic effect of that is that you have a lower effective interest rate, right?
Right.
Let's go ahead. A lot of good stuff here. Oh. If you look at the actuarial assumptions here, is the description of the pension plan here the same as it is in the city's financial statements? Okay.
It's substantively the same, yes. It probably is a bit shortened, but yes, the content is the same.
Well, if you go to the actuarial assumptions on page 47, it's phrased differently. The investment rate of return on 47 is 7% net of expenses, net of premium pension plan investment expenses. And when you get to actuarial assumptions, the actuarial assumptions are 4%.
Those are two different actuarial assumptions, one for the pension and one for the OPEB.
No, I understand it, but why should the assumed rate of return be so different?
That would be a question for the actuary. This information is actually taken directly from the actuary's green books and silver books, depending on OPEB or pension reporting.
No, since OPEB has no money anyhow, so it's all notional, and maybe it doesn't make much difference, but to have somebody who reads page 47 and then reads page 51, and you see different assumptions.
Mala?
Sure, I think I can shed a little bit of light on that. So because there are investments backing up the pension plan, the rate used by the actuaries takes the actual rate of return on those investments into account. Because there are minimal assets backing up the OPEB, there are assumed rates of return based on market rates.
Okay.
So there's different assumptions that come into play there.
You might think about how a lay reader reading the two would scratch his or her head about whether or not it's clear enough what the differences are. I think I understand it now, but anyhow, OPEB is smoke and mirrors. I won't bother you with some of the little stuff. You've done something to yourself on page 55, and you use the word "we" receive final settlement as distinguished from the enterprise. You want to be consistent there. And then there's something which I never have in my law firm. You keep referring to partner organizations on page 56 and 57, and I doubt that your lawyers will say that they're partners.
Mm-hmm.
I certainly wouldn't. So, and every once in a while that rises up and grabs you when you end up in litigation, and you already admit to being a partner of something you certainly don't want to be a partner of.
We'll reconsider the wording on that.
You don't have to pay my hourly rate for it. Now, there is a reference on page 66 to operating leases, account of the new rules about how do you record leases.
No, that doesn't go into effect until fiscal year 21's reporting.
So you haven't,
Not next year, but the year after. So not this coming.
no, I understand, I'm just surprised because in public companies, you're already seeing this now.
Well, GASB's implementation was for the first fiscal reporting year after December 31st of 2020, which for us would be fiscal
I got it.
21's reporting period.
Do you have any idea what it'll look like?
Not yet. We're just at the very beginning stages of amalgamating all of the information and then essentially overlaying the GASB requirement on it.
Tremendous amount of work, as I understand.
Yeah,
It
it's going to
is.
keep us a little busy for a while.
Mike, I'm done.
All right, if there's no other questions about the financials, are there any questions about the management letter? Like, I have some questions in the sense, like, when it says that due to patients and payers was immaterial, we don't have a concept, or I don't have a concept what's immaterial for HHC. For the city, I do. So I was just curious, like, what were these numbers? That would be like, it says like $80 million, similar to that, and reported in the prior years. I'm on page 3.
On the
Matt.
presentation?
Yeah, well, just some comments within the text that was written.
Yeah, we have qualitative and quantitative factors that we use to determine materiality. So percentage of revenue, we look at various different, first year audit, materiality is a little bit different. And then we look at, do we have any issues that came up during 2018 as we're now starting the planning process. We start our interim procedures for 2019. So we look at the results and we factor that into our planning procedures.
As usual, a lot of technology and information systems, but when I got to the prior year comments and reading them, I wasn't clear if these were resolved or not resolved based on management's response. So, just left up in the air.
Right, so what we did is we took the comments from the predecessor auditors and we had discussions with management. We don't test them because they were not our comments. We kind of take a fresh perspective, and anything that might have been similar to the prior, let's just call it in the area of patient accounts receivable, we have our own comment that surrounds it. They might have some of the similar underlying factors from the past, but here, these are really management's responses that they put together from the predecessor auditor comments to keep the.
Yeah, but I guess in my reading of some of these comments, I wasn't clear if they're finished or will they still be there like for 19?
So in some instances, they have been addressed,
Yeah.
and I think we've made that relatively clear in our responses. In other responses where you feel it might be a bit muddled, we were at the time of issuance of the management letter response currently working on it, and it could at this point in time be resolved as a result of just time having passed.
So I guess I would
So,
expect to see these in the 19.
Some of them will be removed. I think a good portion of them will be removed for next year's management letter, yes.
If some of the issues were still outstanding at the time of the audit, they would have been repeated comments, and so you have a couple of repeated comments and others that are resolved. So the ones that have been repeated, we're working on to resolve, and the following audit should drop off, as Nicole said.
No, on page 15, it gets to the liquidity, which I commented before. I was very happy to see that. Anybody have any?
Yeah, if you turn, there's a reference here on page, page 9, to the fact that that you don't include aging categories other than those greater than 365 days. That's an awful long time for a receivable. How did you set it's a year?
So, this is part of the analytics we do on the receivable. It takes us about 270 days or 9 months to a year to collect all our revenue. About 90% of it is collected after 9 months, or up to 9 months, and then we have a remaining 10%. So we value receivables still at a small amount, up to 365. Once it hits 365, we determine that they are relatively uncollectible. So this is just based on analysis we've done in-house.
I guess in today's world where interest rates are relatively low, tolerating this kind of thing is acceptable, but I can't believe that in my lifetime we won't be looking at increase in prime rates and other things, and that's when having outstanding receivables of this kind of number become more significant because the cost of financing them will increase. That's not an audit comment, but it's a business.
I agree with you, but at the same time, I think it's a situational circumstance. So if you take into account the portion of the public that H&H serves, I think that also helps inform why perhaps our receivables are a bit longer standing than other entities would be.
I'm not questioning the fact that they are. All I'm commenting on is in today's low interest rate environment, it's more tolerable than it would be when you had 6% prime.
Right, I'm sorry.
No, go ahead.
So the only other comment that I want to mention, and especially when it comes to accounts receivable, we do look at the days outstanding receivable, which is at 65 at year end. That's our measurement to determine, based on what you're talking about on interest and whether we're getting our money fast enough. On the average, we're representing that they are coming in fast enough on the average. Doesn't mean that there aren't some lagging, receivables out there, but 65 days is the statewide average, and we look to that as a basis for comparison to see how we're doing.
Okay, I have
But
another.
I would say we agree with you, right? We're trying
I'm
to
sure
tighten
you
up.
would.
Yes, yeah, we are trying to, tighten up our revenue cycle. And I think it's probably one of the more significant things that we're working on within finance, trying to get all of our 11, hospitals and 70 clinics all on the same electronic medical record platform versus on 2 or 3, depending on how you count. So I would hope that over the next year when we come back, we will make, significant progress on bringing down the accounts receivable. I feel like we can now manage the accounts receivable much more effectively. But I think this new billing system, claiming system, medical record system should advance our position from where we are today.
One of your brother agencies, or sister agencies, reduced its problem by, in effect, selling the receivable into a finance entity. It's the water company.
Yep, and we are, in certain cases, contracting for assistance in terms of, managing outstanding claims after they hit a certain date. But, be assured that I think this is something that
Okay.
we're definitely, very focused on.
Then just help me out with the word. What is denial activity?
Right,
Does that
so
mean
that's,
somebody says, I'm not paying you?
yes, that's when somebody says, I'm not going to pay you, and
That's what
usually
it
the
is.
insurance
Okay.
companies, and they're rather pretty good at it. And we're just trying to step up our game to match their game. And again, I think over the next year, our denial rate, we refer to it as a metric, we're starting to see it come down even today.
I guess, as somebody who sees these once a year, and as somebody who lives in the city, you're to be congratulated, not criticized, on accomplishing what you're doing here. Because if you weren't managing all this the way you are, you and we would be in worse shape.
Well,
So
we
don't
appreciate
take anything I'm saying as
No.
criticism.
No,
But just
we don't. Not at all.
That's it, Mike. I've got little bits that I'm
No, I
not
think
bothered.
we've seen significant improvement.
Well, we very much appreciate it. Sincerely, I think this certainly I learn something every day at H&H, right? And this experience too, I think just it advances that. It will definitely keep our pencil sharp, right, for the next time around, and we do appreciate the input.
It's when they turn your staff into surgeons.
That'll be a problem. Yeah, that's not our work.
I don't know.
I'd like to thank you for coming this morning, and
Thank you.
like Mark said, these comments are more constructive, but very pleased about the progress that's been made.
Yep.
Thank you.
Thank you.
Mark, do you have?
You'd be shocked if we didn't.
I would be shocked.
You'll have little bits and pieces.
Thank you. Have a good day.
I give it to him. Not that many. Nice to see you. One less.
Yep, take care now.
second year. I thought you looked a little old for the second year.
Process has aged me, so.
No, I noticed in the report, thankfully, that you people feel it's a little too compressed in order. Spread it. No,
Yeah, this was one of the heavier agendas.
This is one heavy set of papers.
The delivery cost was phenomenal.
Hiya.
sounds good.
Yes.
It was truly night and day on HFC from what we've seen in the past.
It's right here.
I don't see these people.
What are we doing this time now?
Good morning. The next item on the agenda is the Controller's report to the City Council and the Mayor on the audit activities.
Good morning. Thank you for having us here this morning. We're very pleased to be here. I'm going to start by introducing my staff. First, I'm Marjorie Landa, Deputy Controller for Audit Investigation. Keith Schwam, who is my Chief of Staff. Faggy Horning, who I think you all know better than I do, been coming here for longer, Assistant Controller. Edward Carey, our other Assistant Controller. Mike Montemiero, Director of Quality Assurance. His staff here, we've got Lynn Elfers, who's the Deputy Director, and Margie-Ann Barnabeo, and Julia Davis, who is our Director of Research and Investigation. Not with us today, but who I'm going to speak about is our Director of IT and security audits, because it's a new initiative that we've enhanced over the last year, and I do want to talk about that. Unfortunately, Andre, not unfortunately for him, he's traveling overseas, but for us, we don't have him here with us right now. So thank you for having us here. I'm really pleased to announce the work that we have been doing, describe some of the accomplishments that we've had in the last year in the office. We continue to be separated into the management audit, financial audit, audit special reports, QA, and research and investigation. And the work for this incredible team and all of the amazing staff auditors, supervisors, and managers, and other staff and support staff that keep us going has been, it's just been gratifying to work with this group. It's a very steady group, turnover sometimes at the younger level, but it's a really solid group of people who are dedicated to helping the city. So just very brief summary of information you've got there. We put out 74 audits and special reports in the last fiscal year. 64 of those were GAGAS audits. There were 10 special reports in that group. And we successfully completed our 4-year cycle, so we're starting it all over again. Our monetary effects in our calculations were 37 million, a little north of that in actual and potential savings, 18.9 in actual revenue and savings, 17.6 in potential revenue and savings, and over $500,000 in cost avoidance through the claim audit work that we do as well. And that puts us in actual revenue and savings ahead of what we have done in other years, but it's just happenstance. It really is not anything brilliant we do. It just happens that the audits we're doing, we get an agency that actually recovers the revenue. One of the things I feel really proudest of is that our follow-up on the adoption of our recommendations has continued to increase. And I think that's a testimony to the way in which our audit staff works with the audit subjects. And hopefully they're getting more comfortable with us and our recommendations. So we made 429 recommendations, of which 85% were adopted by 44 agencies, and 15% were not implemented. But that's the highest level of implementation in 9 years. So we're feeling pretty good about that. One of the new initiatives that we have had over the year is our IT and cybersecurity. We've always or long done information technology audits, but with Andre De Silva, who we brought in, he last from the Federal Reserve, previously with in the private sector, has a very strong technical background and security background, and he has helped to train up our existing staff, and courtesy of the mayor's office and OMB, we have additional funding to hire new staff. And so we are now branching and deepening our audits in the cybersecurity world. As I think we're all painfully aware. The world, as we've sat here, I think has shifted from the beginning of this meeting to now. The technologies have moved on, and the vulnerability of every institution, and particularly we see governments being attacked. I think Baltimore hasn't worked their ransom out yet. Atlanta was held ransom for a number of weeks. The information that the city contains in its computer system is massive and sensitive. And so while the mayor's office, I know, has embarked on its own initiatives on the same theory that having an independent yet government auditor looking as well from the outside is very, very helpful. And so what we have found in those audits is we get 99.9% agreement with what we end up recommending. And in fact, the IT staff in those agencies are grateful that we've come in. It's really very interesting, and it's very gratifying because we're able to highlight problems that maybe staff have seen that management don't take as seriously until it's written out in an audit report. So that's been a really important endeavor. We're going to continue to hire up more technical staff. Our existing staff is amazing, and they have really jumped on this newer aspect to what we're doing. And then just very briefly, Research and Investigations does also issue reports, but their work is not all report-driven. In fact, quite a bit is not. So there were no reports in this year's fiscal year from them, but what we did have is a great collaboration with the law department to develop a model confidentiality agreement, which really doesn't do more than say we'll follow the charter. But it's something put in a form that the agencies are comfortable with. And so we have had, early on, a lot of difficulty with a number of agencies saying, well, we don't want to give you that, notwithstanding what the charter says. And that path has been eased quite a bit. Law department was very helpful in that, and Julie and her group were very helpful in working that through with them. So that was a terrific initiative. So I know you all have the audit report, but I do want to highlight a few of our more, I think, important audits, both for the subject matter, but also some of them we did get a very, very high level of agreement and compliance, and I think that is a testimony to people in the city, but really I think my staff in working well with the agencies. So principal among these, as you know, we always do a lot of audits at the Department of Education. They're an awful lot of our budget, and I sound like a little trite, but they're our future. I mean, that's the children that are educated. It's vital. And one, I think, of the most important audits we did programmatically was the audit of the tracking of homeless students in the schools. And that was a really difficult audit to do. I think we're familiar, we have so many agencies that handle matters that affect children. And you do have Department of Homeless Services, you do have the Department of Education, you have ACS, you have HRA that is dealing with families and other issues. And coordinating the information among all of those entities is a huge challenge for DOE that, has a core mission of trying to teach reading and writing and arithmetic, and has really had a real problem being able to focus on the homeless students. And there's a lot of work yet to come. We identified massive problems, some of which were addressed very early in our auditing work, in communicating with the other agencies. They were not early on common identifiers, so they couldn't get information from DHS about these children that was reliable because it didn't match up with the way they identified their children. But we had a number of recommendations for them. They've adopted some of them. They did not adopt many others, and we're going to follow up on that because it's really such an important area with the growing number of homeless students. We also did some follow-ups, though, on DOE's tracking of computer hardware purchases, and unfortunately, they'd made no progress in that area. They took the position that it's too hard to track where all those computers are. They move, so they're not tracking them in a comprehensive way. They do inventories per school, but it's in our findings quite ineffective overall. And there were a lot of devices that they have on their books as purchasing where they can't find them now, and that's a real problem. We also had a very important.
Because I'm interested.
Excuse me?
How did that problem get resolved?
Our recommendations involve really taking it head on and having a 21st century tracking system, which means you've got to connect up your purchases with your inventory, all in one system. When we did the original audit, they had a system that had that capacity. They hadn't activated it. When we came in to do the follow-up, they were actually switching systems. We recommended that when they switch their systems, they activate both portions. Any one of us can think we might want something and Amazon has it on our front door or at our campsite. I mean, it's amazing what you can do to track with modern technology. The schools, I think it is important enough. Track your students and track your equipment. It's a lot of money that gets spent. And it really could be resolved in a more sensible way than what they're doing.
Well, can this committee help?
I think that would be wonderful, but I'm not quite sure how.
Yeah, well,
Yeah.
could we invite the representative of that organization to address us and get roasted a little?
I think the more sunlight that can be shown on this problem, the better. I think that is a terrific
I turn to my
idea.
fellow members.
I mean, I think if we go through the summary of this, the agencies that are fairly non-responsive are about 4 or 5.
Yeah.
If you went through most of them, they're recommending. So I think the interesting thing would be to focus on those 4 or 5 agencies who have a pretty low response rate. And I would probably reach out, starting with George in the Office of Operations, who might give us some information background, which would help us decide who of these non-responsives would be useful for us to talk to.
And I think the IT area is really terrific as a model where everybody gets that we're actually being helpful. And in fact, you will see in the coming year, we're going to have some of those audits which will not get made public. You won't see them. They're not going to be on the website. We're not looking to show the world where we do not have supported software or patches that have updated the security features in our technology in the city. But we will show the agencies. And I think you all understand we come into the agencies to do the same thing in every area. The staff doesn't always agree, or the management. The staff often does, actually. The folks on the ground who run the programs recognize some of the weaknesses. And so I agree with you that there really are a small number that are pretty consistently not interested in what we have to suggest to them.
And I think we should focus in on those areas and start with the Office of Operations and seeing who and which ones we should be dealing with on a one-on-one kind of basis.
And not just to pick on DOE, but I had one more to highlight because I think it's very interesting from the controller's point of view, which is we looked at limited competition, non-competition contracts, and just looking to see how those were handled, how much money went through. And we did a follow-up audit of that area. And what tumbled out in that audit, which had not really emerged in the first one, was the fact that there was very delayed registration of contracts of these limited competition contracts. So what you had is some of them being registered after the contract was completed. So that meant that the vendors were working at risk. How much risk? Well, they're charging us for it because they're having to pay their staff. They're having to go through and execute. So the value, that of the contract now, the amount they're charging has increased to necessarily cover that, and it limits the competition of who's even eligible to work on those contracts, which again is raising costs to the city. And everybody is at risk when you have them operating without an active and a registered contract. So that was not something we expected to see, and the numbers were really pretty dramatic.
Was that also DOE?
That was also DOE, yeah. So just very quickly, everybody probably, witnessed following the last presidential election and following elections, the number of voters who in Brooklyn were not on the rolls. And so we actually did a Board of Elections audit. The Board of Elections looked at, they addressed those immediate issues. A couple of federal lawsuits, I think, got their attention. And so the issues that excluded voters from the roll inappropriately were addressed. What we looked at then, since we saw that that had been resolved, we didn't need to be there. Justice Department and Common Cause did a nice job before us. But we went out and we had auditors watching 3 separate elections, and we managed to get to about a little over 10% of the poll sites in the city. And what we saw was disturbing, because the operations involve so many people that are there on a temporary basis. They need to be trained, and they need to be supervised, and they need to have accurate information. And we saw everything you can imagine being told to voters who are having trouble with a machine, who aren't on the rolls, trying to do a paper ballot. And we gave them a long list of recommendations there to basically follow the law and train their people more appropriately. And that was, I think, an important audit that hopefully they have taken to heart and will with the other initiatives they're doing to improve our elections. On the money side, we've continued to go through Department of Finance, and they had started out being a less compliant agency, and they've been a very agreeable agency as we've come through and identified areas where they were just not looking carefully at the payments that they were receiving or not receiving, or the exemptions they were giving. Whole areas where exemptions only go to human beings and the taxpayers were LLCs. Pretty easy to figure out, and we've recovered a lot of money. In this case, it was a senior citizen homeowner exemption. Recovered about $9 million in that one. And we also continued in looking at NYCHA, and in this fiscal year, one highlight was the playground audit we did.
Could I stop you, Ms. Lander,
Sure,
please?
sorry.
On that finance audit, you say that the total loss to the city was 59 million. The $9 million that is just applicable to the 2018 fiscal year?
Yes.
So you recouped some from on prior years?
I think the calculation runs in both directions. When you're there's recoupment, and then there's ensuring that you keep people, appropriately getting the exemptions going forward.
I guess the other thing I was going to, too many questions, I'm sorry. To get the senior citizen rent exemption, they have to get it during the year, or once a year, or at the beginning of the fiscal year. What period of time do they have to apply for it?
I believe this is an annual application.
They have to keep
There's
applying.
many of them are. I could be wrong about this one. We did so many, but we had found some where they were not, not even requesting those anymore, notwithstanding the statute. Some are every couple of years, but where they're supposed to certify that you have the senior in the house. If somebody passes,
So it's an annual certification?
I believe that's what it is. No, it's not.
No.
Not for senior citizens.
Oh, okay.
Yeah, I think.
How often, Ms. Herning?
I think that they apply, and then
Could you use your mic, please?
Oh.
If you don't mind.
Yeah, I think they apply for it, and then it continues until,
Once you get it, you have it.
right,
So that's why it's easy to catch errors. People
Right.
pass on, people move.
And it's not as simple as someone passes on, because if the new owner, your spouse, is also a senior, so it's more complicated. On the other hand, the easy part
No,
is it's an LLC.
I guess the other thing is, so you have recouped much more than the 9 million in previous years? Or I'll put it the other way, the city has, due to your particular audits, recouped more money in prior years, and this is the residual?
Yes.
Okay.
Yeah. And then I would start just very quickly, not money, but vital quality of life, the playgrounds at NYCHA. And I've started to say that NYCHA's been very receptive, far more so in the more recent years than when we first started auditing them. And on this one, it was actually pretty easy. As we went to playgrounds and identified, gashes in a slide with the metal sticking up and various other dangerous, that's one of the more extremes, but real. We notified NYCHA immediately, and they actually went and either corrected the condition right away, or they took the equipment away. Fortunately, they corrected a lot more than they took away. We were always disappointed if they just took away the equipment, but we've actually gone back and a lot of it's been replaced. So that was gratifying. And an interesting note on that is that the Parks Department ran a few of those playgrounds, very few of them, but a number. They were all in good condition. So it's doable. We also found some developments where they were next to one another, different management, same population, same budgets. One had good playgrounds and the other not. So again, it's management, it's doable, and they address them. And then I think just last, we looked at the MTA and Access-a-Ride and addressing complaints of riders. That was not a good situation. There were a lot of weaknesses in the way those were addressed. We had previously looked at their performance just on arrival time on Access-a-Ride was not good. Complaints, not very good. They were not particularly receptive to our recommendations. We do hope that, if we can go back, that they will take it more seriously with their new administration. I think yes.
On the homeless service audit, those contracts are mostly for families, shelters for families, or shelter?
Yes.
We got to thank God that we can get those contracts. I'm very serious because it's a major problem. And I think I don't have the original audit with me, I think there was some contention between you and the auditors because they didn't accept many of your recommendations.
This is the one about recouping funds from the...
Yes.
Yeah. We obviously have, the same feeling everyone does, I think, about ensuring that people are housed, and they're housed in decent circumstances. There's a real problem with the way, again...
It's a major problem in the city of New York, the homeless services. We know that.
Yeah.
And it's a major problem to get facilities for families because there's children and
Absolutely.
whatnot.
Absolutely.
And
I think one of the things that...
recoupment is important, but it doesn't cover the whole issue.
Absolutely not, but it's not solely that the agency isn't recouping. What's under there is a structure of paying nonprofits late, not registering the contracts in timely, which is why they don't get paid, which is why they need the advances. So it's more complicated than just recouping. It's really related to the other issue I was discussing with DOE of not registering the contracts. They're shifting the playing field on their side, which makes it hard for the nonprofits, which is why we have this trouble getting people who can actually provide the services. They don't get paid timely, they don't get paid enough, and that's why they need to do the advances.
Yes.
But it doesn't, putting the finances aside, it doesn't cover the issue at
No.
all. It's a major problem.
No, we
And
know
I
that.
think they got to thank God that people are willing to contract with the city to provide homes, or facilities, or whatnot
Yeah.
for these families.
Yes, I
And,
couldn't agree more.
I think it's a major problem.
And I think my concern, and one of the reasons we did this audit, is there's a lot of things the city might do better on its side to make it easier for those vendors to contract with us. Paying them late and paying them too little are problems, and that's why you end up with the situation that we were looking at. It's a symptom. It's certainly not a cause.
I should recuse myself from this conversation because I sit on the board. I'm a major contractor with the city.
It's a major problem.
For dreadfully handicapped kids. get A+ grades for it, but it's painful.
Yeah.
You know, I looked at one here, which is the conflicts of board, collection and reporting of enforcement fines. And they talk about the deposit, the receipts on a weekly basis. That's outrageous. In the 21st century.
Yes, it is surprising to me. There's actually a capacity for the deposits to be made daily remotely. You don't even have to have a human being walk over to the bank. So where we get told by a small agency we don't have the ability to do a daily deposit, I think they need to come into the 21st century.
Well,
that's our recommendation.
How do you go from your recommendation, where they say they won't do it, except on a weekly basis, to getting to do it? What does it take?
Maybe that's a question for the mayor's office, because we can recommend. We can't do more than that. And we can come back and follow up, which we have done, and we recommend again. We get better compliance often the second time through, but not always, and we do still have agencies that are doing weekly, not daily deposits.
Apart from the fact that you're losing the use of the money, it's also the chance of fraud is exponentially higher.
Yes.
I mean, this is...
The interesting part is this is conflicts of interest board.
Yes. Sometimes, it's not us, because we're doing the good work.
Honest to God, Mike, is there something we can do?
I don't know about
Send a
this,
note to
but
the
like certainly the Department of Ed, yes, we could do something. They appear before us. They will be presenting their financials to us, I believe, in November. So certainly we could get together with operations and discuss at least them as a start. Like gathering up, like there were, I think, 24 recommendations that they didn't address or refused to address. And like maybe we'll talk with operations and see how they will address some of them. So that's one agency we could tackle easily. These others, well, I guess we'll get together with operations once again and discuss these issues. I realize these are your comments. We haven't heard their comments. And like it was interesting in some of these, you made some comments, and the agencies basically said, we're very small, we don't have the staff to do that, which I can understand. But like some of these other guys, leave some doubt.
Yeah, it is very challenging for the small agencies, and we know that. So when we come and we look at the control issues, we're not monolithic about our recommendations. It generally is, you need either segregation of duties or some kind of a compensating control. So if you don't have enough staff to completely segregate duties, you do need to add layers of oversight or some means to help ensure keeping, which in a small agency you might get. So this is kind of an equivalent. Everyone knows there's a risk when you're keeping those checks in the top drawer of somebody's desk, which we have found in some locations more than once that we've come in. Things I think are getting better with the electronic capacity, but it did surprise me that we did have one other agency that knew they could do the remote deposits and still do them once a week.
I actually leaned over to Katrina to see if the city was actually doing remote deposits. And, like in the city bank accounts, yes. So, I don't know if this is going to the city treasury or their own bank account, but they still could do it.
Yeah, no, it's all money into the treasury. And, all these fines and fees that we have been looking at.
Some agencies, unless it's changed, had their own bank accounts, and then it got transferred over to the city treasury.
Ms. Landa?
Yes.
The potential revenue of $5.7 million on the Taxi and Limousine Commission, that's on the transfer of medallions?
No, that's on the Taxi Improvement Fund, which is a surcharge we've all paid.
The 30 cents that on the drop?
30 or the 50, I forget, 30? Yeah, 30. Yeah, and so we pay it. And the drivers collect it. It's automatically metered right in
They
to,
don't necessarily remit it.
I didn't say they remitted it, they get it from us. And what happens is, the TLC was not, at the time we did this audit, taking it from mostly it was fleet operators we're talking about. Their position was, oh, the taxi industry is in free fall.
Yeah, I was going
Yeah.
to say, the money almost doesn't count. The taxi medallion industry, like, maybe it's a poor example, homeless service, big trouble over the head. Drivers who bought medallions are committing suicide. I mean, at least so the papers report. And I just don't know what you do. I think that's even more important than the 5.7 million. What happens to the traffic around town with all the Uber cars? I mean, you can't answer that, of course, but there's a lot of trouble.
There definitely is, but one thing that you might have noticed from the audit, what that money is supposed to be used for.
All right, you want to focus on one phase of it.
But that money's for making those cars accessible.
That money's for what?
Making the cars
Retail
accessible.
accessible.
That TIF is supposed to go right back
Yeah, yeah.
into the system. So to the extent it is one of the big fleet owners who definitely are having financial problems, that said, the money's, we're paying it, and it's supposed to go to make the cars accessible.
And we're also, when you punch a 20% tip in, you're paying it on top of that. It's a very offensive burden.
Okay.
You know, there's so many things that are wrong with the Department of Education. It's hard to. One other comment generally, there are, in a number of cases, it says that the agency is in compliance with one recommendation, and it didn't address the remaining four. You can't tell which they've agreed with and which they haven't. Is it possible that you could quantify it, so when you read it, you would know which ones are still around?
Yeah, we can definitely do that.
It's hard, I couldn't figure that out. The other thing it would be, I don't know if you can do it, but when you read this whole book, it's hard without going back and back to figure out who's really getting the good grades and who isn't. And it would be helpful from the standpoint of this reviewer to have a sense of who you think is getting bad grades and who isn't. When they say they agree with 3 and they'll do 2, something like that, to give the reader some sense of quantification of how each of these agencies appears on a scale. So at least I could say, bring that miscreant in before us and see what we can do.
I have been very impressed, though, with the way some of the agencies really have come along to not be completely oppositional to, if we say it, they're just going to say no. But I think that's a good suggestion as well, if there's a way we might be able to highlight some of the good performance, because really the less good performance is pretty obvious, where you see 12 recommendations, the agency agrees with 2. You know, and then my personal favorite is where they agree with some, saying, insofar as we do it already, and we point out in our responses, no, what you're doing now, we say, is insufficient, so we're going to count that as not an agreement, because we're asking you to improve on what you're doing. But really, quite a few of them, NYCHA and Finance among them I mentioned, who have really, I think, turned a corner in really working with us, not against us.
The other comment I would have is that throughout, there's a reference to bad practices having to do with cybersecurity. The number of these agencies which don't do rudimentary things, it seems to me, is not so wonderful. And if this were a public company and you put out a report like this, you'd be looking for the plaintiff's bar to have a picnic. And it seems to me that there should be some centralized directive that says to all these folks, here are the things you must do, and no equivocation, because they're rudimentary.
And there are, and nonetheless, they don't get done, which is all the more reason why I think it is extremely important that you have more eyes on the agencies. So things as simple as password complexity, changing your passwords, ensuring that people who no longer work for you don't have access to the system. Your contractors don't have access to the system.
Yes.
Basic.
Well, you have to look at George to see whether he can make everybody behave.
It was also interesting in two cases, and one had to do with a Little League and one had to do with a park, and it was basically criticizing an agency and saying, and their defense is, not my job, I'm not responsible for it. Whereas nobody's looking at how do you correct it initially.
Right.
And one was defibrillators, I guess, and the other one was unsafe park. And I forgot who the housing authority said.
There was a playground that both parks and the housing authority said, it's not mine. Oh, yeah. I mean, I think the attitude, and there's so many people in city government who have the right attitude, let's fix the problem. You just have to have those people be the people who have the power to do that.
Ms. Lander, you submitted this report already to the council?
Yes.
Do you get questions on the report from council members or council member staff?
Not on the report itself. I never have. So, individual audits, every once in a while, somebody will reach out to us with a question when the audit comes out because...
Other than the commissioner, other than the agency?
Yeah, sometimes, occasionally we'll get somebody from the council who has an interest in something that we've issued.
When the initial audit is issued?
Exactly, yeah. The report tends to get no response, except from this committee.
This is, I assume, put out on the controller's website, so it is a public document.
Yes.
Yeah, I mean, the Parks Department's got a big black eye in a number of places here.
Yes. But they handled their night shift playgrounds very nicely.
Okay. Are there any other comments, questions, issues? Hearing none, I'd like to thank you and your staff for coming this morning, and
I
we'll be
neglected
talking further.
one matter, which is the reason we have so many people from quality assurance is our director, Mike Montemuro, is retiring at the end of June. So he came to show his face, 34 years of dedicated service to the city.
That's a baby.
And he's sticking it out to the end of the fiscal year and not one day longer. And so you see both Lynn and Margie Ann, who are more than able, who will remain, hold down the fort, and we'll so and we're going to miss him sorely. So just want to make sure that he got an appropriate shout out in a community that would appreciate how important the work is that he's done.
Thank you.
Good luck, Mike.
Thank you.
Good luck.
You know,
Mike, can we have a little break?
I guess as I go through this, where I made notes on the pages, it's disturbing to find the same comments over and over again, and here you have the public administrator in Queens with a laundry list of things. Some of it is more exotic in the sense that, but some of it's basic blocking and tackling as management.
Yeah.
And what this says in its own way is that these bits and pieces are not well managed according to standards. And that oozes out of it. And if we ought to have any role at all as an audit committee, I don't know, to read this and ask you questions is not a very satisfying way of fulfilling whatever responsibilities we may have. So if you can figure out some way you can use us better, I personally would feel that I haven't wasted my time as much in reading this thing and having as many comments about performance as I do, merely to just ask you a question. There's something missing in the way we should function, in my view.
Yeah, I mean, this is a repeated question we come in here. It is a frustration for us.
I
We
understand.
recommend. That's what we can do. And sometimes effectively, but, we can't force anything. And the more sunlight, the more people have to answer questions and maybe see the logic of complying or trying to address a problem, not necessarily the way we recommend, but at least try to address the problem. It's better for everybody.
Thank you.
Thank you very much.
Ooh.
Let's take a 5-minute break before Bolton comes. Okay. Can I have a motion to go into executive session?
I just moved it.
Oh, you did?
Didn't you hear me?
No.
As they say,
Adjourn.
Let's make sure we're back in public. Mikhail?
Cameras are on.
Thank you.
Cameras are on. Can I have a motion to adjourn?
Absolutely.
Thank you.